Hello everyone, this is VENTI channel. I'm Yuji Okuno. I'm an interventional radiologist and the inventor of MSK embolization TAME procedure. Today, I'd like to show you our procedure of GAE embolization treatment for knee osteoarthritis. I will introduce one case. This case is a 61 years old male who have several years history of right knee pain, and the pain especially get worse during walking and knee bending. And the patients received MRI, and I will show you the MRI like this. As you can see, there are lots of bone cysts and effusion and synovitis and synovium thickness and total cartilage loss and meniscus loss, medial side total cartilage loss, meniscus loss, and there's some bone marrow edema, bone marrow cyst. So we can diagnose as a severe or end stage knee osteoarthritis, and the care grade will be care 4. And so this case have a weight-bearing pain. This finding indicating that these patients have severe knee osteoarthritis, and it's not good indication for GAE, but the patient doesn't want to receive replacement surgery, so he wants to reduce his pain as much as possible without surgical procedure. So he understood that the mechanism and the GAE procedure effectiveness will be limited, but still want to receive GAE, so we decided to perform the GAE for these patients. Let's see the movies during fluoroscopic movie and DSA during procedure. So first, we have inserted 3 French sheaths in the ipsilateral antegrade fashion in the right femoral and perform angiography from the sheaths. The 10 cc contrast, and using 10 cc contrast performing angiography from the popliteal artery, femoral artery. And as you can see, there are lots of abundant hyperemia, hypervascularity, much to the lesion of synovitis. So the patients basically have medial side knee pain. So medial side first 3 and rapidly enhanced in the medial side joint capsule, and also we can see the lateral side synovitis. So we plan. So as we see this angiography indicating that descending genicular artery is dominant compared to superior medial artery. There is no superior medial, but descending is large. And also the inferior lateral and the superior lateral is large and contains a brush. So we started to insert microcatheter and 3 French basic catheter, angiocatheter into the femoral artery, and now you can see the microcatheter inserting coaxially into the angiocatheter. The angiocatheter shape is like a Jadkin's Light 2.5. and the length is 65 centimeter. It's easy to select the knee genicular artery, including descending genicular artery. So first, I will try to select the descending genicular artery, which allows the medial aspect of femoral artery. Now the angiocatheter approaching to the orifice of descending genicular artery, and after that, I will insert this microcatheter into a descending genicular artery. Now I check the full anatomy of descending genicular and move the microcatheter into the articular branch like this. The big one is articular branch, yes. So now I inserted the microcatheter into the articular branch and proceed microcatheter to the point before the branching, like this. So now I will perform selective angiography of descending genicular artery from here, and I think you can expect the brush from here. So there is lots of brush of joint capsule and synovium brush. So that is the main target of our embolization treatment. And from here, we will infuse the temporary embolic material. The name is Nexfer F. Nexfer F is a first resorbable gelatin particle. The sphere type, the size is around 250 or 300 micrometer, which is resolved within a few hours. So after 1 hour or 2 hours past the volume reduction to 50%. Now I'm infusing the small amount of Nexphere F containing mixed with the contrast and the saline flash. And usually the Nexphere F containing 200 mg, and we put the 10 cc saline and 10 cc contrast, total 20 cc, and using 0.2 cc ml incrementally. So we put 0.2 plus 0.2 saline flash, 0.2 saline flash 3 times, so totally 0.6 ml infused. And after that, I will take angiography. Okay, now I infuse total 0.6 ml and perform follow-up angiography. And this is angiography after infusing Nexphere F. You can see the brush decreased, much decreased. Still some parts remain, so I will infuse more from here. One more 0.2. Now I'm infusing one more 0.2 ml of Nexphere F and saline flash. So I totally infuse 0.8 ml. So now I will move to the next artery. Next target is like a superior lateral or inferior lateral. I remove this microcatheter from the descending genicular artery and pull and remove and go to the more distal and select the superior lateral genicular. Superior lateral genicular is arises from the anterior side wall of popliteal artery. Now I can find and insert the microcatheter into the superior lateral and perform angiography from here. This is a selective angiography of right superior lateral genicular artery. You can see the brush in the lateral side synovium and also the median genicular artery region. So from here, I will infuse again the Nexphere F from 0.2, totally 2 times of 0.2, total 0.4 ml. Okay, now I infuse the 0.4 ml and perform follow-up angiography. Now this is a follow-up angiography, and you can see the brush diminished, disappear. So I move to the next branch. Next branch is inferior lateral genicular artery, like this. Yeah, the origin of inferior lateral is also anterior wall of popliteal artery. Basically, all of genicular artery arises from the anterior side of popliteal artery. Now, I inserted the microcatheter into inferior lateral genicular artery, and this is the angiography before embolization of inferior lateral genicular. This patient basically do not have pain in the lateral side, but patients, as you can see in MRI, patients have very severe synovitis all around the joint capsule. So I selected this artery and to reduce the inflammation and infuse the Nexphere F particle into this branch. Now we are infusing, administrating the Nexphere F. Okay, this is a follow-up angiography. We can confirm the reduction of brush. So the next, I will find the inferior medial genicular artery. Inferior medial is important for the treating the medial side knee pain, especially the inferior medial side of knee pain. So I tried to find vessels, but it was not easy to find. Basically, the inferior medial lies near the joint space or a little bit proximal to the joint space level. Now I find the origin of inferior medial genicular. Because the contrast is relatively heavy compared to the blood serum. So the contrast medium will go to the posterior side due to the gravity. So we have to make the angiocatheter tip to the anterior side wall and have to move and find the origin, to find the vessels like a genicular artery, which is anterior origin of the popliteal artery. That is the important things. And now I find the inferior medial genicular artery. I inserted microcatheter and perform selective angiography from inferior medial. And you can see some slight brush at the pesanserin and also the posterior side brush. So I decided to infuse temporary embolic material from here. Okay, so now I inserted the microcatheter more deeply and perform angiography before embolization. This is a before embolization angiography. You can see this more easy to detect the slight brush compared to the last time. So now this is a good point to infuse embolic material. So from here we infuse the NextFair-F, and after that I also check the atria. Atria is an anterior tibial recurrent artery, but there's no relation to the synovium inflammation. So I go back and check the most dominant artery, so which is a descending genicular artery again, because I want to check the remaining brush or as a result of the distribution of embolic material. Sometimes embolic material resolve or move to the distal side, and the brush will be visible again. So I check the follow-up angiography again from descending genicular, and we can see the slight less compared to the baseline, but still remaining the some brush. So we infuse the NextFair-F from here again. So sometimes if there is some dominant branch, one dominant branch, I will treat the dominant one first and treating the remaining one, and after that go back to the dominant artery and add more embolic material to reduce more inflamed vessels. So now finish our GAE procedure. So we access from the groin and ipsilateral femoral antegrade puncture, and using a 3 French guiding catheter. The shape is Jatkin slide 2.5, and using 1.7 microcatheter, which has small curve in Asahi, the Berute, and inserting the 4 important arteries: descending genicular, superior lateral, inferior lateral, and inferior medial. And checking the dominant descending genicular again, and infuse a small amount of particle and finish the procedure. So today I presented our procedural detail of GAE procedure using NextFair-F. So now we perform the GAE infusion of embolic material from 4 arteries, and now I will check again from the groin entire knee joint angiography again. So 10 cc from the 3 French sheaths inserted in the groin, and perform angiography from the sheath for angiography. And you can see compared to the baseline, this follow-up angiography showing the much reduced brush, but still remaining some part. So I will check the artery of suprapatellar artery. So I inserted the microcatheter again towards the target region. So from now, I will find suprapatellar artery, which is lies near the descending genicular artery. So I think the artery is lies from medial side, yes, like this. And inserted microcatheter into this artery, which is the strong curve, and go down to the anterior side of patellar bone, near the patellar bone, superior patellar area. This is angiography from the AP view, and you can see the brush in the superior patellar region of synovium tissue. And we change the direction to confirm that this artery goes to the anterior side. So we change the direction of C-arm to show the lateral view like this. So changing the view. Now we see the lateral view and perform angiography again to confirm this branch go to the anterior side like this. So this branch actually go to the anterior side, and the superior patellar region or fat part in the superior patellar fat part region or synovium tissue. So we infuse the embolic material again, and that's all. In this channel, VENTI channel, we can provide some detail of technique or the update of the procedure, sometimes communicate with other expertise to discuss about TAME procedure, MSK embolization. We will make a future new video. Please looking for it. Thank you very much. See you next time. VENTI meeting is first worldwide international congress about MSK embolization, TAME procedure or GE procedure. World experts will gather on Tokyo on November 7th and 8th. If you are interested in, please scan this QR code and you can answer the question and can get information about VENTI meeting. We are looking forward to seeing you there in Tokyo. Thank you.